Caring for two means knowing the risks. Hi, I am Virgie Fernandez, and let's talk about preeclampsia. Are you pregnant and experiencing high blood pressure, protein in your urine, swelling, headaches, or blurred vision? These could be signs of preeclampsia. But wait, what is preeclampsia? Preeclampsia is a medical condition of high blood pressure and signs of liver or kidney damage that occur in women after the 20th week of pregnancy. How common is preeclampsia? According to the World Health Organization, it affects 2 to 8% of pregnancies worldwide. Globally, it is a major cause of maternal and infant mortality with approximately 46,000 maternal deaths and 500,000 fetal or newborn deaths annually. What causes preeclampsia? According to some studies, problems with the placental development, more especially the blood vessels that nourish it, cause preeclampsia. The placenta may get inadequate blood flow and oxygen delivery as a result of these blood vessels' improper development or functioning. The mother's blood vessels are then affected by this placental malfunction, which may result in excessive blood pressure and other issues. While the exact cause is unknown, a number of factors including immune system problems, genetic susceptibility, and other medical diseases may be involved. The symptoms of preeclampsia include headaches, blurry vision or light sensitivity, dark spots appearing in your vision, upper right side abdominal pain, swelling in your hands, ankles, and face, and shortness of breath. Severe preeclampsia may also include signs like hypertensive emergency or a blood pressure of 160/110 mmHg or higher, decrease in kidney or liver function, fluid in your lungs or pulmonary edema, low blood platelet levels, and not producing or producing very little pee. If you have severe preeclampsia, your healthcare provider may admit you to the hospital for closer monitoring. In some cases, immediate delivery of your baby may be necessary. Who is at risk for preeclampsia? Healthcare providers have identified certain factors that can increase your risk. Based on these, your risk may be classified as high or moderate. Factors that may put you at risk for preeclampsia are history of high blood pressure, kidney disease or diabetes, expecting twins, triplets or more, autoimmune condition like lupus, and preeclampsia in a past pregnancy. Factors that put you at moderate risk of preeclampsia are being pregnant for the first time, having obesity, being older than 35, family history of preeclampsia, and complications in prior pregnancies like low birth weight. What are the complications of preeclampsia? If not treated, preeclampsia can become life-threatening for both you and your baby. During pregnancy, some of the most serious complications include seizures, eclampsia, coma, stroke, heart disease, and developing preeclampsia in future pregnancies. The most common complications to the fetus are premature birth, low birth weight, and placental abruption. How is preeclampsia diagnosed? If your healthcare provider suspects preeclampsia, they may order blood tests to evaluate your kidney and liver function, recommend a 24-hour urine collection to check for protein in your urine, and conduct an ultrasound and other fetal monitoring to assess your baby's growth and amniotic fluid levels. How is preeclampsia treated? Treatment for preeclampsia depends on how severe it is and how far along you are in your pregnancy. If you're closer to full term or around 37 weeks, your healthcare provider will likely recommend early delivery. Vaginal delivery is still possible, but a C-section or cesarean section may be the safer option in some cases. You may receive medication to help your baby's lungs develop and manage your blood pressure until delivery. In many cases, delivering early is safer than continuing the pregnancy. If preeclampsia occurs earlier in pregnancy, when preeclampsia develops before full term, Your provider will monitor you closely to prolong the pregnancy as safely as possible. You can expect more frequent prenatal visits, ultrasounds, blood tests, and urine checks, and home blood pressure monitoring. If your condition worsens, early delivery may be necessary to protect both you and your baby. How can you reduce your risk of preeclampsia? If you have risk factors for preeclampsia, there are steps you can take before and during pregnancy to lower your chances of developing it. First is you have to achieve a healthy weight before pregnancy if you have obesity. Manage existing conditions like high blood pressure or diabetes. Exercise regularly as recommended by your healthcare provider. Get enough sleep and manage stress, and follow a balanced diet that is low in salt and limits caffeine intake. Preeclampsia can be serious, but with early detection and proper care, you can protect yourself and your baby. Stay informed, attend your prenatal visits, and never hesitate to speak up about your symptoms. Together, we can ensure safer pregnancies and healthier mothers.